So taking Tylenol is not good. All right, I'll say it. It's not good.
Most of that evidence is based on correlations and not causation. It is true that there is a correlation there, but when you look at the best data, which does a better job separating correlation and causation, you do not see a link between acetaminophen or paracetamol use in pregnancy and autism in children.
It's the same as saying people with lung cancer have matches in their pockets. It's not the matches that gave them the lung cancer, it's the smoking. But the matches, they just correlate with the smoking.
A significant and controversial news conference from President Trump, described by him as historic steps to confront the crisis of autism. His words. The US leader has said, taking Tylenol, which we know as paracetamol, is not good for women who are pregnant. US officials have claimed a link between pregnant women who use it and autism in children. Now, what President Trump has said tonight is hugely controversial because the vast majority of scientists and researchers believe there is no single cause of autism in children. It's likely to be the result of a complex mix of factors. Here tonight, the UK Medicines and Healthcare Regulatory Agency has reiterated that it is safe to take paracetamol when pregnant, and there is no evidence it causes autism. This is what President Trump has said in the last 40 minutes.
Tylenol during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary.
I've been talking to the author of Expecting Better, who's also a professor at Brown University, Emily Oster, and she told us what the science says about any link.
There's a lot of evidence on the potential links between Tylenol and pregnancy and autism in children. Most of that evidence is based on correlations and not causation. It is true that there is a correlation there, but when you look at the best data, which does a better job separating correlation and causation, you do not see a link between acetaminophen or paracetamol use in pregnancy and autism in children.
And when you use the word correlation, what does that mean in terms of this evidence?
So when we talk about correlation, what we mean is that the women who use these medications during pregnancy, their children are more likely to have autism or ADHD. But it is not necessarily the case that the use of these medications causes them to have these conditions. It may just be that the women who are taking these are different in other ways, and that is what's driving the difference in diagnosis. The best evidence on this, most of which comes from comparing siblings, shows that if you can take out these maternal factors and really just focus on the medications, then you don't see those links between paracetamol, acetaminophen use, and autism in children.
Okay, and so what is your advice to women who might be pregnant now and who might be worried?
First, don't worry. The best data does not support a concern here. And second, if you need Tylenol to treat a fever, to treat pain, it is the safest painkiller that we have for use in pregnancy.
Simple as that.
Yeah, simple as that.
Let's talk to a man who resigned last month as a director of the US Centre for Disease Control. He worked alongside the US Health Secretary, RFK Jr. His name is Dr. Demetre Daskalakis. Thank you very much for talking to us. I wonder if you could tell our audience, first of all, why you did resign.
I resigned because I was very concerned that the firewall between science and ideology was coming down, and that was driven primarily by the actions of the secretary.
And tell us what you think of this announcement from President Trump tonight.
Yeah, I mean, I think that this really reflects an announcement that comes from Secretary Kennedy. I think that Secretary Kennedy is doing the same thing with autism that he'd been doing in the vaccine space, really having a preconceived idea, preconceived notion, and then really passing it off as vetted science. And I'm very concerned that with imperfect data, without showing what the work is behind such statements, that there have been some very sweeping sweeping statements made about a drug that is safe and that really protects pregnant women and their pregnancy from some pretty severe outcomes.
And why would a health secretary make sweeping statements, as you call it, without looking properly at correlation and causation?
You know, I think that is an excellent question for the secretary in general. The scientific process does not seem to be something that he values. I think looking at what's happening with vaccines in the country very similarly, unvetted data are being elevated to a status of actually being well-vetted science and then being moved quickly into policy. My question would be, show us the work. Where are the data? Where is the expert consultation that you've had? Where is the document that is backing up such a claim? Otherwise, it's just a soundbite.
Right. So is that what you're expecting to see now after this press conference?
I mean, in the times before, one would expect that there would be documentation that backs up any such claims. Maybe FDA will share something, but just knowing what the body of literature is around Tylenol, acetaminophen, or paracetamol, really there is an association with autism, but it doesn't play out as a cause. It's the same as saying people with lung cancer have matches in their pockets. It's not the matches that gave them the lung cancer, it's the smoking. But the matches, they just correlate with the smoking. So that's what we're looking at. If there's not data to actually link acetaminophen or paracetamol with autism, then it's just another association. It's like matches in their pocket.
How worried are you, though? Because a lot of people will simply see a headline on a website, on the top of a newspaper, on the strap across a TV programme without searching for data, and it will worry them.
Yeah, I was worried enough to quit, to resign from CDC because of the way things were moving, not only in the space that I work in, which is respiratory disease and vaccines, but just the general scientific mission of the U.S. government and the way that Secretary Kennedy is really, again, not showing his work, not showing the data, and just making sweeping claims. My answer is always talk to your physician. If you're pregnant, talk to your OBGYN. Ask them what they think. I think that is way more important than any soundbite by Secretary Kennedy.
Having worked with him, what is motivating him?
Yeah, I can't speak to his motivation, but I can definitely speak to the outcome, which is going to be chaos and confusion for pregnant women for a drug that really doesn't have the evidence to necessarily point to it as a cause for autism. So again, I can't speak for the motivation, but I know that the outcome is going to be chaos and confusion.
And you know that it will prompt some people to do their own research, quote unquote. I mean, what should people keep in mind if they're going to Google this?
Yeah, so I would say first, maybe not Google. I think that probably, especially for pregnant women, this is a great time to have a conversation with your OBGYN, with your obstetrics and gynecology doctor to see what they recommend. What they're going to say is minimize use of any unnecessary drugs, and that includes acetaminophen or paracetamol. But there are circumstances where that drug is really important in protecting the health of the mother as well as the child. So talk to your doctor is going to be the answer, and I think will be the answer as long as we have a Secretary of Health in the United States that doesn't focus on evidence, but rather focuses on sound bites.
And one final thought from you. Donald Trump tonight also talked about vaccines. He appeared to cast doubt on the efficacy of some vaccines. What would you say about that?
Vaccines are one of the miracles in modern medicine that has really increased our ability to live long and healthy lives. I really hope that as the sort of science continues to accrue around vaccines, that we don't throw out the baby with the bathwater here and decide that based on preconceived notions by the secretary that we're going to somehow destabilize decades and decades of progress made because of vaccines. So I'm going to hope that there are other scientists that are around the president who will be able to clarify the importance of vaccines as well as suss out some of the mis and disinformation coming from his Secretary of Health.
Thank you for your time this evening. We appreciate you talking to our audience. Thank you very much.